Thanks, everyone, for joining us today. As Reema said, today you'll hear how Procter & Gamble has achieved operational efficiencies by implementing the Celsis rapid detection system that gives them the opportunity to release product more rapidly than traditional methods. To help set the stage for Neil, I'd like to start by talking to you a little bit about the impact that traditional microbiological methods have on a manufacturing operation. And, in fact, probably your manufacturing operation if you haven't already implemented rapid methods. Traditional testing methods are not lean. The methods were developed over 100 years ago. They're very manual, they're labor-intensive, and quite subjective. Most importantly to our discussion today, they're very slow, taking 3 to 7 days or even more to get results. So while you're waiting for the results of your micro-testing, one of two things is happening. Either raw materials, work in process, or finished product is being held in quarantine, awaiting the results before either entering into the production cycle or entering into distribution in the case of finished product. And while that may have worked in the past, the current model really doesn't work in today's produce-to-demand environment where both you and your customers are trying to minimize inventories at the same time that your customers are actually increasing their demands on you and the need for you to be responsive to their changing needs. If you're not holding product in quarantine, if you have felt the pressure to release product quickly, then you may in fact actually be producing product or shipping product into distribution at risk in order to accelerate and minimize the impact of that quality assurance hold time. So when you look at your own operation, there's a couple of questions that we'd like to pose to you. How long does it take to convert raw materials to finished product that's available for sale and in distribution in your operation? And out of those number of days in your production cycle, how many of those days are actually consumed by quality control testing? And where, in fact, is your product when you get the results of your QC testing? And finally, let's give some thought to just how much that costs your operation. If we think about quality using some of the terms from lean as it typically applies to lean manufacturing, then we can take a little different view than what we usually do of the quality assurance function. The tenets of lean suggest that a portion of production lead times are consumed by non-value-added activities or waste, rather than the true value-added activities that transform resources into products or services that customers are actually willing to pay for. So non-value-added activities or waste are essentially costs without benefit. So a lean approach to manufacturing, and we would suggest a lean approach to quality, seeks to identify and reduce or eliminate those sources of waste. When we talk about lean practitioners typically refer to 7 forms of waste that may appear in the production cycle: overproduction, waiting, transport, inventory, processing, motion, and finally defects. Defects is frequently the only element of lean that actually gets linked with product quality, and in doing so, it's usually thought of only in terms of zero defects, not production efficiency. But if we think about how using more time than is actually necessary to complete quality testing, then it's pretty easy to see how the absence of a lean quality program really contributes to waste in a number of these areas. If we look at overproduction and inventory, longer lead times may require more safety stock in distribution to account for the fact that your manufacturing operation can't respond to changes in demand in a rapid fashion. And in addition to safety stock, simply the quality hold on raw materials or finished product in inventory also adds to waste in terms of inventory and production. Wait time, the longer our lead times, the more pauses we have in the production cycle, then we're talking about product, materials, and people on hold waiting for QC results to continue on with the production process. And then transport and motion, simply product and material being shuffled around the plant and staged in different areas until quality assurance or quality testing can be performed on product, allowing those materials to move into production or finally into distribution. So in lean manufacturing terms, excessive waiting for test results is a non-value-added activity. So, although screening products for quality is critical, absolutely necessary, it's also very time-consuming. And time, in lean terms, can be wasteful, and certainly in any terms, it's very expensive. But there is a lean solution. While traditional microtesting takes 3 to 7 days to get a result for every part of the production cycle where you might be performing quality testing, the Celsis method utilizes an objective, reagent-based diagnostic assay and delivers results in just 24 hours. So the production impact of that is significant. If we graphically look at just two of the parameters that we've talked about here so far, investment in inventory and production or product cycle times, we can see that there's dramatic differences between a traditional micro approach and the Celsis 24-hour method. This illustration shows us an example of what would be an 18-day production cycle. And if we look at the red block, this illustrates working capital that's invested in raw materials, work-in-process inventories, and finished goods awaiting final release across the entire production cycle. So each of those 18 days represents inventory at some point in the production cycle where value is being added towards taking it to a finished product. So the entire red block then is the cumulative capital that's invested in work-in-process inventory. By contrast, if we look at simply making the change of implementing the Celsis micro method and reducing our micro hold times, the blue block here illustrates a significantly shorter production cycle where we've gone from 18 days down to just 10 days. And by definition, we now have a much more responsive manufacturing operation, much more responsive to changes in demand or other changes that need to be made in the production schedule. And the total blue block now illustrates a greater than 50% reduction in working capital invested in work in process over what we saw with the traditional method. So in short, a leaner, more responsive, and much more cost-effective manufacturing operation. So before I turn it over to Neil, I'd like to put up a poll here and get some feedback from you. Of the following factors, if you look down on the bottom right-hand side of your control panel, you can see the questions that have been asked here, and you can cast your vote by clicking on one of the answers. So our question for you then is, of the following, which do you think has been the major factor keeping your industry from more widely adopting rapid methods? Number one, a lack of awareness. Two, benefits or value or return on investment is not clear. Three, a general resistance to change. Four, the cost to implement, either money or time. Or five, you just don't feel like it's a fit for your industry or products. I'll give you a moment here where the poll will be up for, I think, 2 minutes as we move forward, and then we will share the results here in a few minutes. So let's talk a little bit about Procter & Gamble. Procter & Gamble has been a customer of Celsis since the mid-1990s. We all know P&G as a top consumer products company with net sales approaching $90 billion, two-thirds of which are in personal care, oral care, and household products. The quality and micro lab at P&G contributes to operational excellence, and the Celsis program certainly is a part of that. The Celsis program is recognized at the highest levels within P&G management. And today we're very pleased to have Neil Lewis with us, who is the micro-technical lead for the Global Product Delivery Group. Neil?
Thanks, Judy. When Celsis asked me to come and talk to you in this webinar, it was basically to talk through our experiences in terms of how we've implemented rapid methods. As Judy said, we've used Celsis, particularly in the divisions I've worked in, for the last 10 to 12 years. We currently do over 1.5 million tests, finished product tests, a year in one of our divisions. using the Celsis instrument. And we've been exploring rapid methods for more than 10 years. We primarily use it at the moment in 3 categories: personal care, healthcare, and household products in over 50 countries. And that's at our manufacturing sites. Of course, we sell the products in many more countries. The thing we've done over these 10 years is the development of the Celsis technology in P&G has been very much collaborative. We've had ideas, we've had requirements, we've had requests, and Celsis have picked those up, and we've been able to develop together a number of technologies which have significantly helped us put more product into the market faster. But what I want to do is, if you're thinking about rapid methods, there are some things you need to think about in order to get these sorts of things implemented. Because if you do, what I found in my experience is, if you do this badly, it then sort of makes it difficult to look at future rapid methods or other options that you might have. So you may think, why is there a picture of a car here? Well, it's because what we found is, when you speak of new technologies, people tend to think like car showrooms. Everything you see in there is bright, shiny, and new. Everybody wants the latest gadgets, the GPS, the remote starts, whatever. But people are never quite sure how it works, and it's exactly the same with microbiology. You know, a lot of people will come in and say, this machine will do everything you want to do and cut out all your hold times and give you all this extra capital and all this extra inventory that you can release. It's very simple to use. It'll save you money, and your kids will love it. And I think there's an old English expression: it'll make the tea as well. But the real question you have to ask yourselves is, do you really need it? Will it actually benefit you? And so what I thought I'd do is I'd talk through to how we thought about implementing some of these rapid methods. You first want to decide, where do you want to use it? We primarily use this technology for finished product testing, driven by a number of the factors that Judy talked about. You know, our customers want us to be more responsive. It's difficult to be responsive if you're waiting 3-5 days for a micro test to come off. Some of our larger customers want a 24-hour or less turnaround. Difficult when you have susceptible products. You may want to use it for testing water and raw materials to cut down your demurrage, to make sure that the materials are fit for use going in. You may want to use them to monitor your environment. Again, if you're making a product, there's no point knowing that your manufacturing environment was contaminated 4 days after you made the product. If you're dealing with food products or sterile products, you may want to know what the bugs are in there very quickly. With the recent spate of food contaminations we've been seeing, a number of manufacturers are looking at, can we get the identifications of the organisms we're interested in very much quicker? And from an R&D point of view, if you're doing challenge testing or preservative screening, again, waiting 28 days till you finish that may not, basically slows down the whole of your initiative and development cycles. Stability testing equally has a part to play in the R&D things. So I think the first thing you've got to do is decide where you can get the biggest bang for your buck in terms of using these types of rapid methods. Why are we chasing rapid methods? Well, as I said, from a P&G point of view, it's driven by the business. We make an awful lot of products, and we make them very quickly. If one of our sites has 300 to 400 trucks arriving and departing every day, holding that much inventory tends to get prohibitive if you're doing it over numerous days. Equally, that product that you're holding costs you money in terms of warehouse space, in terms of having to move it, in terms of keeping the environment right, keeping the stability right. It's much better if you can get it out of your facility, know it's good, and send it to the customers. The other thing is, some of our products have a relatively short shelf life. So the sooner you get it to the customer, the better, the longer it sits on their shelves and they're not having to pull it up. So it allows you to maximize your shelf life. P&G is particularly into produce to demand, so we don't want to be making it unless we've got a customer who can buy it. And so as products are leaving the shelves in some of the big supermarkets, they are asking us to replenish and replace it, which means we have multiple short runs to fill up those shelves. So you can't do produce to demand where you have traditional microbiological testing, because you can't wait 3 to 5 days. What it means is if you're going to do that, you have to store inventory. And if you store inventory, it's going to cost you money. You certainly can't do just in time. And your flexible manufacturing tends to, if you're storing inventory, you tend to maximize the scale and size of your runs. So your manufacturing is not that flexible. The other part, from a pure microbiological point of view, is if you get contamination, you know it's there faster. So you can do much better damage limitation, much better control, and you appear to your microcontrol programs appear to the regulators to be much more stringent because your speed of reaction is better. So you put all that together, it eventually saves you money. And from a P&G point of view, that's what we were truly after. There are some quality truths that we have to fit into all of this, because quality is not negotiable. The consumers expect it, our customers expect it, and the regulators expect it. Right? You're not going to convince a consumer or a customer that it's okay to have product that might be contaminated or could be contaminated. You certainly won't convince the regulators of that. The bit that people don't understand is you have to pay for some of this. I know back in the 70s and 80s there was this thing, the quality is free. In fact, I believe it did more harm than good, because quality is free providing you're prepared to put the initial investment in. Because you have to spend money to make sure your product's right. You've got an ongoing maintenance program, and what I think people miss is they miss the holistic view of the cost of quality. Yes, you may have to make an investment, but if it makes your product good and the consumer recognizes it, then you're going to get that benefit. You're going to get the benefit back in increased sales. So if you look at a matrix, if you have poor quality, you're going to have failures in the marketplace. You're going to end up with recalls. And as we've seen in the food industry and a few other industries, there have been significant numbers of recalls. Your customer service is going to suffer. And worst of all, your brand image is going to suffer. That's of particular concern to larger companies who basically operate with well-known brands that consumers trust. And if you have failures in the plant, you've got rework that you have to deal with, you have scrap, you have overtime to pay for. The other thing is, if you're making product you can't sell, you're not making product you could sell. So therefore, it links back to your customer service and consumer perceptions. If you look at it, if you want to pay for the right quality, you have to inspect for it. Or one of the perceptions is you have to inspect for it, and that means positively release. That means positive inspection. That really is the old style quality control type of mentality. There are ways of planning for it. And again, it's an investment you have to make. You have to design your processes. You have to build in the right initiatives. You've got to do this quality by design. Quality is never an accident. It's always designed in. And the sort of those things that would be is, if your process is clean and all your raw materials are clean, then it's very likely your finished product is going to be clean. And those are ways that you can build in assurance that your finished product is right. And you end up with your finished product testing actually being a simple matter of confirming versus trying to detect organisms. Because believe me, after 30 years of doing this, you're never going to get a test that will detect organisms in your finished product. The size and scale of the sampling is too much. So what you want to be able to do is be able to have a sequential process done quickly, as Judy pointed out, that gives you confidence that your finished product test, which you also will do quickly, is good. So basically what you have to do is when you're doing these cost of quality equations or discussions is to think about what the quality is actually costing you in terms of inventory, in terms of extended production times, in terms of remanufacture, in terms of capital invested to handle rework the product and stuff like this. None of that gets built into our equations from when we're looking at the benefits that rapid methods can give you. If you look at it from a production cycle time, this is the classic method. Bring raw materials in, test, formulate, test, package it, test. That gives you a bunch of safety stock. If you can reduce the test time, you can still do the same operations, but your safety stock's significantly reduced. And in some cases, this can be matters of $5, $10, $15 million per days of inventory you can reduce, depending on the size and scale of your operation, or depending on the shelf life of some of your products. So the question is, where would you use a rapid method? And when we were doing this, we looked at 3 or 4 scenarios. If you have a cosmetic product like a mascara, small shelf, small size, you can pack a lot of them into onto a pallet or into inventory. Your batch size is relatively small, 20 to 30,000 units. You clean and sanitize between batches. You have a 3-year shelf life. The question is, would you really have a benefit of a rapid method there, other than the other benefits of knowing that you had a problem quicker, you could deal with it faster, you could actually be more responsive? But really, that one would be that one could go either way. The second scenario, you're making 200 ounce, which is probably a gallon or 5 liters of detergent. You're making it 40 to 60 tons an hour. It's a continuous process. You clean and sanitize every 10 to 20 days, and the product has a 1-year shelf life. You surely want to get that out very quickly, and you also want to know something's gone wrong very quickly. So that is a classic case for where a rapid method would really benefit you. And the third scenario is basically somewhere between the two. You make smaller sizes, you make it on a batch, but you mix them in storage tanks, you clean and sanitize periodically, you have a longer shelf life. Again, if you want to truly be responsive, if you want to make sure that you're not having a problem, and you really don't want to be building warehouses, then this would probably tie itself up to be a good case for using rapid methodologies. When you're using them, rapid methods need to be sensitive. So they need to be at least as sensitive as the current traditional methods. Fortunately, what we found is the rapid methods tend to be more sensitive, and that can give you some unforeseen benefits, which I'll talk about a little later. But they have to be sensitive. They have to be practical. When we were looking at these rapid methodologies, we said there's no point having 3 pieces of equipment you need 4 PhDs to run, and you get 3 tests out a day. It might be very rapid, but those really aren't practical. You need things that have a high throughput. So they've got to be easy to use. They have to be cost-effective. And again, you have to look at this cost-effective part holistically. If by going to a 24-hour test period, you cut out 2 or 3 days of inventory, then the fact that the test may cost twice as much to do shouldn't be a consideration, because in the overall scheme of things, you're actually saving a lot more money. And one of the things I've tended to find in companies I've been dealing with is that they tend to look at things on a unit cost basis. So, okay, this test now costs me $6. It usually costs me $3. My lab budget's going to go up by X. They're not thinking about how much inventory you've released, and and from a company point of view, how much money you've actually been able to save. The other thing from our point of view, which may not apply to some of your situations, is we needed these systems to be available globally, because if we're operating in 50 countries, we don't want to have different methods in different sites testing different products. That just leads to confusion. So we wanted not only the equipment available, we wanted the service, we wanted the backup systems available globally. The other things you should consider is, will it work? Every method has its limitations, and we've discovered a few with the methods we've been investigating. But you want to find out, you want to try and make a method that's suitable across a broad range of systems, so you don't have multiple methods, multiple levels of investment. The broader range you can make this equipment, the better. It needs to fit in with your product release systems. So those of you using systems like SAP and stuff like that, the system needs to be compatible so that you can get information transfer versus having a manual interface where you can get transcription errors. How does it fit with your shipment and manufacturing systems? If you're only shipping once a day, then how does your test methodology fit in with that? And finally, what do the regulators think about it? Because if you're making a number of regulated products, as we are, then you have to make sure that they are in sync with the technology, the understanding, and the validation you're going to do. And in some recent meetings I've been to, the regulators are actually being some of the people pushing for rapid methods, not so much because of the money-saving aspects, but just because of this ability to detect things faster and the ability to react faster. So when you choose a method, you want to look, as I said, is it suitable for a wide range of things, and how accurate is it? It has to be at least as accurate as the current methodology you're using. If you can get more accuracy or more sensitivity, that's better, but you need to think about the impact that will have on your operation. The method's got to fit in the current system. This cost per test versus the benefits you get really needs to be clear. That would be part of what, when we talked about the poll, that was the question about the benefits and the value of the return on investment. I've seen multiple cases where people are not really clear on the benefits of these types of systems. It's got to have a high throughput. If you're sites very rarely have single manufacturing lines or single raw materials. It's got to be reliable. It has to be dependable. You have to be able to depend on it. It's not, you don't really want a system that is up and down because that soon ends up being discredited. And that links to what level of support and stuff you need regionally or globally. I would advise you to think about doing a rapid check, a reality check on how the rapid method fits in with your supply chain. Because sometimes people, again, this goes back to my analogy of the new car. Everybody wants a new car. It's nice and bright and shiny, but there's no point buying a 6-liter engine if you're trying to drive around the center of a big city because you never get to use it. So while it may look good, you need to understand, does it fit within your supply chain? How much complexity does it bring with you? What's it going to take to get it implemented? I mean, for reference, we implemented 40 Celsis systems in our manufacturing plants in our detergent business in a year and a half. And that was a very complex undertaking to get the equipment in, to get the people trained, to get the systems up and running where people could rely on them, to the point that versus their, should we say, the traditional methods which they believed implicitly in. So overcoming that cultural barrier was a significant change. So, you need to think about that and you need to build in the cost for that in terms of the investments as well. The other question is, are you really set up to deal with the results? Because if you're getting, with a lot of these rapid methods, they rely on enrichment techniques, which are more sensitive than the traditional plate counts. So you tend to find more. Now, most microbiologists will tell you that's probably a good idea because you know what's going on. But are your specifications set up to deal with it? Because in a lot of cases, whereas you can use a plate count and the spec would be less than 10, an enrichment is a pass-fail test, and you may need to go in and change your specifications to relate to the output from the rapid method. And can you get the right level of acceptance and understanding from the people who are actually going to be operating it and dealing with the results? If you've got a rapid method and people say, well, every time we get a positive, we're going to test it via the original method and believe that, then what's the point in your rapid method? They're willing to believe it when it gives you the answers you want, but not when it gives you the answers you don't want. That really is never going to work. So you need to make sure that the cultural aspects are right as well. One of the things you've got to understand to make this thing, there is no one magic bullet that does everything. You have to think about how can I integrate rapid and conventional methods across the system. Understand the limitations that some of these rapid methods can have. As I say, a pass-fail test versus a quantitative count. Right? But if you're clear on the methods and the ancillary systems are supportive, you can make this thing work well. And I put together an example of one of the systems we tend to use. This is how we've integrated rapid methods into the system. So for material testing, we will tend to use plate counts. And the reason for that is we have multiple suppliers. We use commodity materials. They tend to have common methods, and they tend to be common they tend to standardized on the most, shall we say, standardized on the traditional methods. And so this allows us to basically specify to our suppliers off a common base. And also, when you're dealing with rapid methods, some of them can have some interference, and the traditional methods tend to be less prone to that. So while you're getting materials from multiple global sources, you can reduce the level of interference. So we're testing raw materials using plate counts. There are a number that we're exploring using rapid methods for. It's just that we focused initially on finished products, and now we're working our way back. But at the basics, we're doing plate counts. Water, we do filtration, standard method, because basically it's the best way. For finished product and intermediates, we use Celsis, and what we do is we screen out basically all those that give us positive tests. Now, we've worked at it, and we are currently, 99.5% of our product passes the Celsis system first time, which means that we can ship all of that product with a high degree of confidence. And we've done the validation that shows that we know that there are less than one organism per gram in each of the products we're shipping, because that's what it takes. That's the level of validation we've done to give us the confidence in the Celsis system. We do that in 24 hours with minimal interference. For packaging, we test plate count swabs, again, traditional methods. When we're doing identification, we have the standard gram stain, but we've also got a new system that we've helped Celsis develop, I think would be a way to say, which gives us the ability to do identifications off the back of our Celsis test in 2 hours versus 24. And I'll show you some detail on that in a minute. And then we use Accugenix, which is a rapid 16S identification system. For MDM samples, we tend to use, again, the traditional methods, samples, plates. But for cleaning and sanitizing validation, we again switch back to looking at ATP as well as traditional methods. So between all of this, we're able to manage our inventories to a relatively small level, and also assure that the quality of our products leaving the sites is very good. This thing about the hardest thing we found to get people to understand is the difference between a quantitative count and a screen. And with a screening test, you're able to get once the systems are set up, once you've done the validation, you're able to ship the majority of your product knowing it is clean, and then you're really only having to deal with products that fail the test, which you can then go into quantification, identification, or depending on your shelf life and the nature of your product and the cost, you could just say, if it fails the test, I'm going to scrap it and carry on. And we have both situations going on in our sites, depending on the nature of the product. But the other thing it does is it stops you getting into a theoretical debate, because most microbiologists will tell you there's very little difference between 90 CFU per mil and 120 CFU per mil. So writing a spec of less than 100 or less than 1,000 really doesn't make a lot of sense. So you end up in debates, well, it's only 99 it can pass, it's 101 it fails, which from a scientific point of view doesn't really make a lot of sense. The Celsis gives you a much simpler thing. It says it passes or it fails. And if it fails, then you deal with the consequences of the failure, versus having inordinate debates with non-microbiologists about the significance of 1 CFU or 50 CFU. And that can be from a manufacturing point of view, it may not seem like a lot, but it gives a great degree of clarity. And most of our manufacturing sites, I found, love the clearer you are, the better they can operate and the better they can understand. So having a pass-fail test can have some significant advantages. There are some unforeseen benefits we've found as well. The speed of reaction, the speed that a test like Celsis gives you, means that we can do a much more of a predictive trend analysis on a day-to-day basis. So we can look, in the same way as you would control chart most processes, we can create control charts in terms of Celsis data that's passing and failing. And we've noticed that these trends can be indicative of when either we're having failures in some of our raw materials, or maybe there have been changes in the system and stuff like that. So it adds an extra facet to your microcontrol program. I've already talked about the speed increases. The speed and the sensitivity gives you a shorter reaction time. So we can be actually saying, okay, something's failed. We can be cleaning and sanitizing and have the thing back in production before the traditional TVO methods would have told us that something has failed. The sensitivity, people tend to look at both ways. I believe that it is better to know when you've got a problem developing versus have the discussion around the specification of a plate count. It's a simple measure. We have a bunch of people who I like to call scorecard junkies. So you can actually scorecard a lot of this data in terms of passing, failing, in terms of percentages. And you can actually use it to drive a lot of your action plan improvements and actually measure the improvements in terms of your percentage failures. And this because it's pass-fail, it's understandable by all. You don't get into debates around the specifications, which can happen. So for the future, I think there's for the manufacturers, it's important that once companies invest in this type of technology, and there is a capital investment to talk about, that you have to spend and to get started. And what we need to do is get to the maximum utilization of that system. So the ability to test finished products, raw materials, water, and these other things, they have to be built onto the technology, not have different technologies and different pieces of equipment, because that's just going to add complexity, which basically we won't be able to work with. So expand the applications and look at this integration, so to define a complete system approach. From a user point of view, the one thing I don't think the users have been very good at, and I think it's one of the reasons that we don't have the scale of implementation of rapid methods that we should have, is as industries we've never been clear what the requirements are. The only thing that we've been able to agree on is plate counts, and that doesn't really help any of the businesses. So as an industry, I think there's a need for common approaches to validation, common approaches to specifications, and integration of these types of rapid methods into the systems versus trying to rely on the traditional approach, which has served us well for many years, but really isn't going to fit with the current business requirements or the business world that we're working in. Here's an example that I talked about, which is this React system that we've worked with Celsis on, and we've just finished validating in a number of our plants. So what this does is it gives you the ability to take a sample from your enrichment broth and determine either the species or the gram stain. We're using it for the gram stain in 2 hours versus another 24 hours. So, the way we're thinking about this is in 26 hours, we'll know something's contaminated and and in most cases, the type of organism it's contaminated with, which is a huge advantage for us in terms of being able to both track down what type of contamination it is, assess the risks, and also react in terms of how do we clean, sanitize systems, stuff like that. It's really a plus point because in our validation against traditional gram stains and verified by 16S identification, the React system proved to be correct versus the 16S 94% of the time. Traditional gram stains were only about 75% correct. So, not only this again is where you take some of this new technology, you build upon it, and you end up with something that gives you a higher degree of accuracy so you can make better decisions and get product, either release product or not release product, depending on the results. So the thing I think over the last 10 years that we've been able to establish is P&G really understands the value of the rapid methods. A lot, from a quality assurance point of view, it gives us confidence that because of the sensitivity, the speed, and the accuracy, we're getting good product out the door. And from an operational point of view, they're not being held up in terms of not being able to get product to the customers when they need it. And it's allowed us a considerable degree of freedom in terms of being responsive to our customers. The other thing it says, we don't have to do certain things because we've got this rapid method in place. So we don't have to build warehouses as our volumes increase. What we're able to do is, we have a couple of days window that we didn't have before. We don't have so much scrap because we don't have 3 days product on hold. We only have 1 day's product on hold, and we're able to react much easier. And we certainly don't have to hold as much inventory, which our financial analysts love, because basically inventory to them is seen as wasted product because it isn't out on the shelf being sold. So from a company point of view, P&G certainly understands the benefits that rapid methods can bring you. Celsis is the one that currently works for us, and a lot of that has been due to the sort of partnership and stuff we've developed over the last 15, 20 years in terms of developing this type of technology. And so I think what we're doing is we're basically continuing this partnership to help us reduce operating costs by linking quality, operations, manufacturing, supply chain, finance all together. So we get a completely transparent view of the benefits that the rapid methods bring us, or are there, being perfectly honest, there may be a situation where the benefits are few and far between. And then we have to look at what are some of the more subtle benefits and decide whether they are a plus point or not. But I mean, the thing is, you can only really do that when you have this truly holistic view and not get mired in the unit costs or the cost per test or the cost of holding pallets and stuff like that. But look at it on a far more holistic point of view. And externally, we're looking to improve the results by getting a number of our suppliers into it, by looking at getting our contract manufacturers to think about the same types of technologies or the same types of approach. I mean, if they want to use a different rapid method, that's fine, as long as they validate it against to the right degree. That's okay. But this type of thinking that they have the ability to influence their businesses by doing this. And then we're continuing to work with Celsis to look at what are our options for the future, and how can together we look at a business model that gives us the right degree of quality, the right degree of security in our release, and the right flexibility with the business as needed. So, Judy, I think it's over to you.
Okay. Thank you very much, Neil. I think Neil tells a very compelling story for the benefits of rapid methods and how P&G has benefited from them. So this is probably a good time to take a look at the poll results from our first question, which you can see down at the on the bottom right-hand side of your control screen, it looks as though we have 39% of respondents are concerned about the cost of implementation. 27% benefits value of the return on investment is not understood. I think that this speaks in part to an understanding and sort of the holistic view that Neil has suggested. We need to take a look not only at costs in the quality lab, but ultimately in the impact that rapid methods have on the manufacturing operation. As we move forward here, I'd like to ask you one more question, and we're going to move through this poll pretty quickly because we're getting a little bit short on time, and I want to make sure we have some time for questions at the end. The final question: of the following benefits listed below, which statement is most likely to motivate you to learn more about a rapid screening system for faster product release? Eliminates 4 days or more for microhold, a system that pays for itself in 6 to 9 months, a reduction in inventory requirements, a reduction in warehouse space requirements, a reduction in the overall production cost or cycle time, a system that's easy to validate, a system that is easy to implement, or a system where strong global support is available. Certainly, there may be more than one of those options that are interesting to you. We'll ask you to just pick one of those and cast your answer there on the bottom right-hand side. And actually, I'm just getting a note here that says that you have to vote in order to see the poll results. So please cast your vote so you can find how your colleagues are responding here as well. And I think carrying on with this idea of there are clear and compelling reasons why rapid methods make sense. There are clear financial benefits, but why haven't more companies implemented rapid methods? And I think that there might be another reason as well. I think that many companies are organized in ways that cause people to work in silos. And within any particular silo, departments focus on their own budgets. They have their own priorities. They speak their own language. When we look at production, production tends to end when product is packaged, and that's a silo. If we look at the quality department, and particularly micro, I think it tends to be managed as a cost center, and that again is another silo. So in the case of rapid methods, we're looking at the cost of a testing system being borne by the microbiology department, but the financial benefits accruing outside of the quality department to manufacturing, distribution, and warehouse operations. So in short, expense and impact are occurring in different silos, and when those people in different silos aren't talking, then the understanding of that holistic view isn't seen, and companies don't move forward. I think it's understandable that if a production head is looking to reduce his production cycle time, that the first place that he looks isn't necessarily the quality department. And again, when we're looking at quality as an expense center, they're looking at the cost of quality moving to rapid methods as actually being an increase. With pressures on departments to reduce spending, that's a difficult question for them to be asking, is to invest in capital equipment that will actually increase their budget. And yet we've seen in the discussion with Neil and some of the information that I shared earlier, that's really only part of the picture. The broader view is that there are less visible costs that aren't visible to the quality group, including quarantined inventory, safety stock, warehousing, the impact of contamination events, and the time that it takes to recover from a contamination event, and of course the working capital that it takes to fund all of that. So taking that holistic view, we can see that looking at the company's operation as a whole, reducing manufacturing cycle times, even while raising costs in the quality department, really do drive cost savings and make a lot of sense. Those savings can be quantified. The Celsis Financial Impact Assessment is a financial model that was co-developed by management consulting firm Arthur D. Little and another of our global customers to help quantify the value of implementing Celsis globally. The financial impact assessment has been used by many Celsis customers to help support their analysis of the system, and using pretty basic, straightforward operational data, we can tailor a cost analysis to your organization that gives you a 5-year net present value, a return on investment of implementing the Celsis system, identifies a payback period, and also separates out the reduced cost associated with contamination resulting from being able to deal with those issues faster. Typically, in the assessments that we perform, it's common for an organization to see savings of over $500,000 over the first 5 years of implementing the system. So, in summary, I think we can agree that rapid detection can drive significant and quantifiable cost savings to your organization by reducing the cost and time of manufacturing, reducing inventories and safety stock, detecting contamination faster. As Neil outlined, the benefit of rapid methods, they must be selected with care, they must be fully integrated into your existing operation and validated as effective. I think finally, lean quality is an important aspect of lean manufacturing. It is a multifunctional undertaking, and I think it's time to start the discussion between quality, operations, and finance if you haven't already done so. So I think we will, it looks like we do have the results ready for the second poll, so let's go ahead and take a look at those. Okay, so again, we have two very strong answers here. Reduces overall production cycle times. 39% of you responded that would move you to take a look at rapid methods. Very similarly, eliminating 4 days or more from time to result, another 26%. So I think that that's very good news, because what we're hearing you say is that you are looking at the impact of rapid methods, that the efficiency that it can bring to your operations, and that is a holistic view that we need to take. I think now will we open up? We have a few minutes for questions. So I hand that back to you, Rima.
Hi, Judy. Thanks very much. Thank you, ladies and gentlemen. All of you are still with us today for this really fantastic presentation. Just before we go on to the Q&A, I've noticed we've had a couple of questions already come in. Just wanted to draw everyone's attention to the screen very quickly. If you, quite a few of you have already asked if the presentation and the webinar recording will be available later. Yes, it will be, of course, and Neil and Judy have been kind enough to provide us the PDF of this as well for you to follow through. But if you'd like any more information, and if you'd like to find out a bit more from the speakers themselves, please just take a moment to jot down the email address that you see on your screen. It is to contact Cindy Lieberman at Celsis, and she would be able to pass on any of your questions and queries over to both Neil and Judy post-webinar. So on that note, I just wanted to point out this was a question we had in from Laura Black, and I guess this is one for Neil, which is asking, was there one main reason or benefit that made P&G choose an RMM and the Celsis method specifically? And how hard was it to get it sold into the company?
Okay. Was there a main reason? Basically, what we drafted up a user specification, if you like, as to what we would like to see the methodology do. And then we went out and assessed all the available rapid methods at the time. And basically, the reason we chose Celsis was it fitted most of the parameters that we had on our user specification, better than any of the other sites. So, I mean, that was the real reason. It was a result of if you like, a best value option analysis. We went through all the options against our criteria. Celsis fitted the bill in terms of, okay, this gives you the best option. Now let's go see if we can make it work. How difficult was it to get sold into the company? There was some initial resistance, and to be honest, that's where we learned this holistic thinking trick. Because the initial thing was, well, you're asking me to put in a system which I have to invest capital in, which I don't know, and cost me more. Why? And that's where some of our microbiologists actually became financial planners and turned around and said, well, look, yes, here's your initial investment, here's the benefit. And I think we were talking somewhere in the region of $15 million a day in inventory for one of our product families. So basically, when you can say to somebody, A, I can give you 2 days inventory back, B, I can make you more responsive, and C, I can tell you when there's contamination occurring at a much faster rate. Once we were able to clarify those, getting it sold into the company was really a piece of cake, because the evidence was so compelling. So the more data you have on the financial benefits, and you use the financial muscle in your companies to generate those, then I think that's what really got it sold in. Versus, they didn't really want to understand the technology. What they wanted to know is, will it work? Will it work reliably? And what benefits would I get? And if you can answer those 3 questions, then I think it's not a problem.
Okay, thanks very much there, Neil, and quite a comprehensive answer. I hope that answered your question, Laura. We had just another one, again for you, Neil. Has P&G been able to estimate or quantify the financial value of using rapid methods?
I would say yes. I'll be honest, I don't know how at liberty I am to share the information. What I would say is that it's been significant. For one of our business divisions, which is where we use, it's the one I used to work in primarily, and we use Celsis as our basic test method. It's allowed 2 things. It's saved us significant amount of inventory, in the orders of magnitude I was just talking about. But the second thing it's allowed us to do is it's allowed us to change our release strategy from a high volume, virtually continuous system, which had some risks in it, to a positive release controlled product strategy, which gives us a lot more confidence, makes us a lot more secure with the regulators, and also makes us a lot more secure with our customers. So I think, if you like, whereas you can talk in terms of $15-20 million per day of inventory, the other benefits are a little bit harder to quantify in terms of dollars, but it's been a significant benefit to us.
Okay, brilliant. Ladies and gents, I think we have just one last question that we have time for today, and this one goes to Judy, if you're still there with us. How long does it take to implement and validate the system?
Well, I think that's an excellent question. It certainly depends upon the breadth of the product that needs to be validated. But typically a validation program with support from the Celsis technical support team, it involves some basic validation and comparison to the traditional method to ensure that results are equivalent to the current method that's being tested, that's being utilized. We can typically group similar products together so that not every single product or SKU that a company is manufacturing needs to be validated. We can validate like products together as groups. And with a dedicated effort, you're doing some level of parallel testing, but it's not really an onerous process to get validated. So that's not a really specific answer, because it would vary company by company. But that's certainly a part of what Celsis is there to do, is to support that validation process.
Can I add something, Judy?
Absolutely.
If you want some specifics, we basically grouped our products in families and validated families. We had a clear rationale for why they were grouped into families. So we make a number of products that vary in color and fragrance versus the base formulation. So we were able to do that. Similarly, some cosmetic businesses have been able to say it's the same product, just different shades. They've been able to do the same thing. So we were able to do it by families, which simplified the process significantly. We adopted a validation and verification strategy. So basically, we validated the basic method with Celsis' help in terms of where the level of sensitivity, where the level of detection was, and then we measured product interactions, we measured specificity within the products, and then we took it to the plants and did some comparison studies versus the traditional methods. We've actually run this on some drug products as well, and there the real question came up from the regulators in terms of the level, the sensitivity, because basically they wanted to know how are we linked to the monograph method, and basically what we were able to demonstrate is that our level of detection in terms of using Celsis was below that of the monograph method. So we would find something in Celsis before the monograph method would react. And so as long as we reacted appropriately to a positive test, then the regulators were happy in terms of using a rapid method versus the traditional method. So it didn't involve a slightly different approach in that respect. But we were able to, the method, the family type system and the method of validation we did, and the scale of validation we did was generally well received by the regulators.